underscore 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 on 4 underscore 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 on underscore underscore 5 underscore 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 on 9. Mr. Aaron determines Mr. Jones is having alcohol withdrawal and arranges for him to be transferred to the acute care hospital. List 5 nursing interventions for the client experiencing alcohol withdrawal. 1. Underscore 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 on 2. Underscore 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 on 3. Underscore 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 on 4. Underscore 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 on underscore underscore 5. Underscore 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 on 10. Mr. Aaron is discussing the client's diagnosis with one of the new nurses who is orienting to the unit. Mr. Aaron asks the nurse to identify the 5 axes. List the 5 axes on the psychiatric diagnosis. 1. Underscore 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 on 2. Underscore 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 on 3. Underscore 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 on 4. Underscore 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 on underscore underscore 5. Underscore 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 on Chapter 14 Case Studies, Care of Clients in Various Settings 411 Case Studies 412 Prioritization, Delegation, and Management of Care for the NCLEX-RN Registered Exam Maternal Child Case Study MS. Anne is working in the newborn nursery, Ms. Laura is working in the labor and delivery unit, and Ms. Courtney is working in the postpartum unit. 1. Ms. Anne is assessing the newborn for reflexes. Identify 5 reflexes and how to elicit the response from the newborn. 1. Underscore 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 on 2. Underscore 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 on 3. underscore 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 on 4 underscore 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 on underscore 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 5 underscore 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 on 2. Ms. Laura is assessing the newborn to determine an APGAR score. Identify the 5 assessment interventions used to determine the newborn's APGAR score. 1. Underscore 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 on 2. Underscore 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 on 3. Underscore 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 on 4. Underscore 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 on underscore 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 5 underscore 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 on 3. Ms. N is assessing a 2-hour-old newborn. Identify the assessment interventions Ms. N should implement. Do not list what is normal, list only the components of the physical assessment. Underscore 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 on underscore 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 on underscore 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 on underscore 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 on underscore 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 4. Ms. Courtney is caring for clients in the postpartum unit. She is assessing for postpartum complications. Match the complications with the signs/symptoms. Chapter 14 Case Studies, Care of Clients in Various Settings 413 Case Studies Signs/Symptoms 1. The mother is lightheaded, syncopal, hypotensive, and tachycardiac, and has oliguria. 2. The mother has fever, uterine tenderness, and foul-smelling lochia. 3. The mother is sad, weeping, irritable, anxious, and confused. 4. The mother has dark bleeding with clots and there is a non-contracted, boggy uterine fundus. 5. The mother has a sudden rise in uterine fundal height, indicating the formation of clots inside the uterine cavity. 6. The mother is complaining of severe, sharp perineal pain and swelling in the perineal wall. 7. The mother is exhibiting bizarre behavior and has disorganization of thought, hallucinations, and delusions. 8. The mother has pain and has a fever along with localized tenderness, swelling, and redness of the left leg. 9. the mother has marked breast engorgement, acute breast pain, tenderness, and fever and chills. Complication: A. Postpartum depression. B. Uterine atony. C. Thrombophlebitis. D. Retained placental fragments in the uterus. E. Endometritis. F. Mastitis. G. Postpartum psychosis. H. Hematoma. I. Postpartum hemorrhage. 5. Ms. Laura is teaching parents in a child preparation class about labor and delivery. Define the stages of labor. Underscore 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 on underscore 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 on underscore 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 on underscore 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 on underscore 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 6. Ms. Courtney is performing discharge teaching to the mother. List 5 interventions Ms. Courtney should discuss with the mother. 1. Underscore 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 on 2. Underscore 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 on 3. Underscore 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 on 4. Underscore 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 on underscore 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 5. Underscore 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 on 414 prioritization, delegation, and management of care for the NCLEX-RN registered exam medical nursing case study answers determining the order to see the clients. The first client to be seen by the nurse should be the C. client who has unexpected or abnormal data. If all of the clients are apparently stable, then the client who has the greatest risk for a complication should be seen first. In this scenario, 1. C. Mr. Gonzalez, diagnosed with chest pain. Rule out myocardial infarction should be seen first. Chest pain associated with lack of oxygen reaching the cardiac muscle is a high risk for a complication. 2. D. Ms. Smith, diagnosed with diabetic ketoacidosis, should be seen next to determine blood glucose levels and whether insulin replacement therapy is needed. 3. A. Mr. Brody or E. Mr. George can be seen next since both have issues with pain. Pain does not kill but should be addressed to make sure that neither is experiencing pain at this time. 4. A. Mr. Brody or E. Mr. George can be seen next since both have issues with pain. Pain does not kill but should be addressed to make sure that neither is experiencing pain at this time. 5. B. Ms. White, diagnosed with bacterial pneumonia, should be seen last. Ms. White has been in the facility long enough for the nurse to receive a report. This client should have received at least the first dose of antibiotic by this time. 1. Ensure the client is NPO. 2. Hold the client's oral medication. 3. Administer the intravenous medication. 4. Make sure the informed consent form is signed. 2. 1. Assess the client's breath sounds. 2. Assess the client's respiratory rate. 3. Assess the extremities for capillary refill time. 4. Assess for buccal or circumoral cyanosis. 5. Assess level of consciousness. 6. Assess pulse oximeter reading. 7. Assess the client for productive/non-productive cough. 3. 1. Check the client's serum potassium level. 2. Question the medication if the client's B/P is less than 90/60ths. 3. Question the medication if the client is dehydrated. 4. Check the client's intake and output. 5. Assess the client for signs/symptoms of hypokalemia. 4. 1. Check the client's glucose level. 2. Check to determine if the client is NPO. 3. Ensure the client eats breakfast to cover the regular insulin. 4. Ensure the client eats lunch to cover the intermediate insulin. 5. Administer the medication in the client's abdomen. 6. Assess the client for hypoglycemia throughout the shift. 5.1. Assess the client's pain on a scale of 1 to 10. 2. Rule out any complications prior to administering pain medication. Assess urine for blood. Strain the client's urine. 3. Check the medication administration record, MAR, to determine the last time Mr. George received pain medication. 4. Sign out narcotic medication from the medication delivery system, Pixies. 5. Check MAR against client's ID band. 6. Determine if pain medication is compatible with primary 4. 7. Check patency of client's foresight. 8. Push intravenous pain medication slowly over 5 minutes. 9. Assess client's respiratory rate. 10. Document on MAR and in nurse's notes. 11. Implement safety issues, bed low position, side rails up, call light within reach. Answers to Case Studies Chapter 14 Case Studies, Care of Clients in Various Settings 415-6. The following should not be delegated. Cut Ms. Smith's toenails. UAPs and nurses should not cut a client's toenails, especially a client who has diabetes. This presents an opportunity for the client to develop an infection and possibly lose the foot. Rub and massage Ms. Smith's lower extremities. Nurses and UAPs do not massage the lower extremities because of the risk for dislodging a clot in the extremity. Feed Ms. Smith the breakfast meal. The UAP should not feed a client who is 24 and can feed herself. The client should be encouraged to be independent. 7. 1. Assess bowel sounds in all 4 quadrants. 2. Assess abdomen for firmness and tenderness. 3. Assess last bowel movement. 4. Determine type of bowel movement, soft, hard, dark color. 5. Assess N/G tube output, coffee ground, green bile. 6. Assess amount of N/G tube output. 7. Determine if N/G tube is on low intermittent suction. 8. Assess the client's nair for irritation. 8. Assess cardiac enzymes including troponin, CPKMB. 9.1. Put the calculi, stone, in a sterile lab cup. 2. Label the cup and send to laboratory. 10 ms. Teresa should not make assumptions about what Ms. Smith knows. 1. Ensure client knows how to take insulin injections, correct way and time. 2. Ensure client knows how to treat hypoglycemia. 3. Ensure client knows how to treat hyperglycemia and when to call the HCP. 4. Ensure client knows how to count carbohydrates. 5. Ensure client knows importance of daily exercise. 6. Ensure client knows how to assess and care for feed. 7. Ensure client knows sick day rules. 11.1. Refer to a dietitian. 2. Provide Mr. George with written handouts. 3. Limit oxalate to 40 to 50 mg each day. 4. Drink 8 to 12 cups of fluid each day. 5. The body may turn extra vitamin C into oxalate. Avoid high doses of vitamin C supplements, more than 2,000 milligrams of vitamin C per day. 6. Oxalate is found in many foods. Limit foods such as soy cheese, soy milk, soy yogurt, cereal, bran or high fiber, fruitcake, pretzels, wheat bran, wheat germ, whole wheat bread, whole wheat flour, dark or robust beer, black tea, chocolate milk, cocoa, instant coffee, and hot chocolate. 12. 1. Discuss use of sublingual nitroglycerin, NTG. Take one every 5 minutes. If no pain relief, get to the emergency department. Do not drive, keep NTG in dark bottle, medication should burn under tongue. 2. Instruct Mr. Gonzalez to stop any activity if chest pain occurs. Then take NTG as above. 3. Discuss a low-fat, low cholesterol, no fried foods, instead, boil, bake, and grill meats. 4. Discuss the importance of walking daily for 30 minutes. 5. Discuss the importance of not smoking or being around second-hand smoke. 6. Discuss the need to eat small, frequent meals and avoid large meals. 13.1. Determine Mr. Brody's gag reflex has returned prior to giving PO fluids or food. 2. Assess the client for any abdominal bleeding. 3. Administer Mr. Brody's AM medications. 4. Give Mr. Brody water and breakfast or lunch meal. 14.1. Check Ms. Smith's blood glucometer reading. 2. Give Ms. Smith a glass of orange juice. 3. Give Ms. Smith a complex carbohydrate after feeling better such as graham crackers, peanut butter crackers, or cheese and crackers. 4. Ensure Ms. Smith stays in bed. 15.1. Elevate the head of Ms. White's bed. 2. Administer or increase oxygen via nasal cannula. 3. Notify the respiratory therapist. 4. Stay with Ms. White and attempt to calm her. 5. Request client to take slow, deep breaths. 6. Assess Ms. White's bilateral lung sounds. Case study answers 416. Prioritization, delegation, and management of care for the NCLEX-RN registered exam 1. 1. Check ventilator settings with prescribed settings. Tidal volume rate positive and expiratory pressure, PEEP, FiO2, oxygen concentration, mode of ventilation control, assist control, intermittent mandatory, IMV, synchronized intermittent mandatory ventilation, SIMV, pressure support ventilation, PSV. 2. Check ET tube placement. 3. Maintain proper cuff inflation. 4. Check all ventilator connections. 5. Have manual resuscitative bag at bedside, ambu bag. 6. Ensure all ventilator alarms are on and answered promptly. 7. Empty condensed water from water traps. 8. Assess client's respiratory status, pulse oximeter, arterial blood gases. 9. Complete respiratory assessment, lung sounds, LOC, etc. 10. Assess client's reaction to muscle paralyzing agents. 11. Ensure upper extremity restraints are on properly and assess for neurovascular compromise. 12. Suction with end-line suction as needed. 13. Collaborate with respiratory therapist. 2.1. Assess for pallor, petechiae, purpura, oozing blood, hematomas, and occult hemorrhage. 2. Assess PT/PTT, prolonged, fibrinogen and platelets, reduced. 3. Administer blood products, platelets, cryoprecipitate, fresh frozen plasma. 4. Administer heparin or low molecular weight heparin. 5. Avoid 4 and IM injections. 6. Use soft bristle toothbrush. 7. Use electric razor. 8. Protect from trauma that may cause bleeding. 3. 1. Administer high-liter oxygen and monitor pulse oximeter/arterial blood gases. 2. If pulse oximeter reading/ABG results continue to drop while client is receiving supplemental oxygen, it is ARDS. 3. Prepare to place client on ventilator, only treatment, along with treating underlying cause. 4. See question 1 for care of the client on the ventilator. 5. Some clients respond positively to being placed in the prone position. 6. Address nutritional needs. 7. Assess client's respiratory status. 4.1. Assess for spinal shock, decreased reflexes, loss of sensation, flaccid paralysis. 2. Assess for neurogenic shock, hypotension and bradycardia. 3. Assess for respiratory status in C6 and ascending paralysis. 4. Maintain bowel and bladder integrity. 5. Address immobility issues of the client, pneumonia, pressure ulcers, DVTs, contractures. 6. Maintain appropriate temperature of environment. 5.1. Frequent neurological assessment using the Glasgow Coma Scale. 2. Assess for increased intracranial pressure, ICP. 3. Monitor respiratory status. 4. Place client with head of bed up 30 degrees or greater, to promote venous drainage. 5. Limit suction passes to 15 seconds, to prevent increased ICP. 6. Keep client normothermia. 7. Decrease environmental stimuli. 8. Assess for raccoon eyes, rhinorrhea, battle sign with otorrhea, halo, or ring sign. 6.1. Ensure patent airway. 2. Administer pain medication, including nitroglycerin sublingual and intravenous morphine. 3. Administer oxygen via nasal cannula or non-rebreather mask, and monitor pulse oximetry. 4. Obtain 12-lead EKG. 5. Monitor ECG telemetry readings. 6. Monitor cardiac isoenzymes, including troponin, CPKMB. 7. Prepare to administer thrombolytic therapy, if appropriate. 8. Provide reassurance and emotional support to client and family. 9. Perform cardiovascular assessment frequently. 10. Bed rest and activity limitation for 12 to 24 hours, with gradual increase of activity. Critical Care Nursing Case Study Answers Chapter 14 Case Studies, Care of Clients in Various Settings 417-7. 1. 80% of the clients have dysrhythmias. 2. Heart failure. 3. Cardiogenic shock. 4. Papillary muscle dysfunction. 5. Ventricular aneurysm. 6. Pericarditis. 7. Thromboembolism. 8. 1. Shout, shake client, and check for carotid pulse. 2. Call a code. 3. Start CPR/advanced cardiac life support, ACLS. 4. Defibrillate at 360 joules. 5. Administer epinephrine IVP. 6. Administer lidocaine or amiodarone IVP. 9. Problem 1. Nutritional problems. 1. What to feed, when to feed, how to feed, route of administration. 2. Collaborate with registered dietitian. 3. Enteral or parenteral nutrition. Problem 2. Anxiety. 1. Encourage client to calmly verbalize concerns and ask questions. 2. Include client and family in all teaching, explain purpose of equipment and procedures. 3. Administer anti-anxiety medications cautiously. Problem 3. Inability to communicate. 1. Use alternate methods of communication, picture boards, magic slates. 2. Use hand gestures. Have client use eye blinks for yes/no questions. 3. Assess client for nonverbal communication. Problem 4. Intensive care psychosis, sensory perceptual problems. 1. Identify and address factors that may precipitate delirium. 2. Use clocks and calendars in the ICU to help orient to time. 3. Limit noise in ICU, such as monitoring how many equipment alarms are going off, no paging. Problem 5. Sleep disturbances. 1. Attempt to structure sleep, by creating a wake cycle, Cluster activities, schedule rest periods. 2. Dim lights at night, and open curtains during the day. 3. Administer sleep medications, if needed. Problem 6, Pain 1, assess client's pain on 1 to 10 scale. 2. Rule out any complications secondary to pain that require medical interventions. 3. Keep client comfortable. Problem 7, include family/significant other in all aspect of client care. 1. Share pertinent information with family. 2. Allow family to be involved in decision making. 3. Ms. Paula should discuss what to expect when visiting clients in ICU, such as machines, noise. 4. Least restrictive visiting hours. Case study answers 418. Prioritization, delegation, and management of care for the NCLEX-RN registered exam 1. 1. H2, C3 times 10 to the power of 4th, P5, A6, O7, B8, D9, M10, K11, F12, N13, G14, I15, L16, J2. 1. Tell the client an informed consent form must be signed for this procedure. 2. Explain the client cannot eat or drink anything 8 hours prior to the procedure. 3. Tell the client N4 will be started and he will be sedated during the procedure. 4. Inform the client he will not remember the procedure when he wakes up. 5. Tell the client the nurse will be taking vital signs every 15 to 30 minutes after the procedure. 6. Explain the client's gag reflex will have to be intact prior to any food or drink being given, usually 2 to 4 hours. 7. Tell the client the throat should not be painful but may experience some discomfort. 8. When the client can drink without vomiting, the client will be discharged from outpatient clinic. 9. Instruct the client to contact HCP if any bleeding, pain, or vomiting. 3. 1. The client will sign informed consent form. 2. A bowel preparation will be prescribed by the HCP the day before the procedure, which could be Goli-Telly, Fleet's enema, and the bowel must be free of feces prior to the procedure. 3. The client will be on a clear liquid diet 24 hours prior to the procedure and NPO 8 hours prior to the procedure, no red fluids. 4. Explain that N4 will be started and the client will be sedated during the procedure and should not remember anything. 5. Client will be positioned in a knee chest position with the anal area exposed. 6. A sigmoidoscope will be attached to suction machine and the HCP will insert the scope into rectum. 7. After the procedure, client will be placed in a comfortable position. 8. The nurse will assess the client's bowel sounds, vital signs, and the anal area for bleeding. 9. The client will be able to go home if no complications. 10. Instruct the client to report any rectal bleeding, any dizziness or lightheadedness, signs of blood loss, and any abdominal pain. 11. Explain to the client she can eat as needed and encourage the client to rest for a few days. 4.1. Explain the procedure to the client and gather the needed equipment. 2. Perform hand hygiene and don non-sterile gloves. 3. Position the client in the high Fowler's position. 4. Remove the sterile applicator from the culture tube by rotating the cap to break seal. 5. Instruct the client to tilt head back and open mouth. 6. Use tongue depressor, if desired, to depress tongue. 7. Swab the back of the throat along the tonsillar area from left to right. 8. Remove the applicator stick and place in the specimen tube. 9. Insert the stick into the tube until the swab is saturated with culture medium and the cap reaches black dot. 10. Label specimen tube and send to laboratory. 5. 1. Tell the client to remember the acronym RICE: rest, ice, compression, and elevation. 2. Rest prevents further injury and avoids stress on the injured ankle. The client should wear a brace or splint provided by the HCP. 3. Teach the client how to use crutches so no weight can be placed on the right ankle. 4. Tell the client to apply ice to the injury to help decrease pain and edema. 5. Instruct client not to apply ice directly to the skin. Use a towel between the ice and the skin and apply ice for 20 minutes at a time. Outpatient Nursing Case Study Answers Chapter 14 Case Studies, Care of Clients in Various Settings 419 Allowing at least 30 minutes to elapse between applications. 6. Apply a compression to support and help prevent inflammation. 7. Show the client or significant other how to apply an ACE bandage by making a figure 8 wrap. 8. Inform the client not to apply it too tightly, toes should not be cold, turn blue, or tingle. 9. Explain elevation helps the body absorb fluid that has leaked into the tissue. 10. Tell the client to elevate the right foot above the level of the heart. 11. Recommend the client use ibuprofen for pain, and take the medication every 4 hours with food. The client can alternate Tylenol to help control pain. 12. Instruct the client to return to outpatient clinic or emergency department if pain is not relieved by ibuprofen/Tylenol, foot becomes numb, the client is unable to move the toes, or they are cold to the touch, or if edema has not decreased in 48 hours. 6. Explanation: antibiotics are not prescribed for the common cold because antibiotics treat bacterial infections and the common cold is caused by a virus. 1. Explain the cold symptoms will usually last about 1 or 2 weeks. 2. Recommend the client drink water, juice, and clear broth, which will help loosen congestion and prevent dehydration. 3. Recommend the client not drink alcohol, coffee, or caffeinated sodas, which will increase possibility of dehydration. 4. Recommend salt water gargle to help relieve scratchy throat. 1/2 teaspoons salt in 8 ounces of warm water. 5. Recommend saline nasal drops and sprays for nasal stuffiness and congestion. 6. Zinc products are recommended for a cold and can be purchased over the counter. 7. Recommend chicken noodle soup, which may have anti-inflammatory and mucus-thinning effects which makes the client feel better. 8. Explain there are numerous over-the-counter cold and cough medications, however, they will not prevent a cold or shorten the duration of a cold. Some OTC medication may cause complications, for example, Tylenol can cause liver dysfunction, and many cause drowsiness, so the client should not operate machinery or drive a car. 7.1, H2, C3, a 4 times 10 to the power of 5th, B6, I7, D8, K9, F10, G8. Question 1. The American Cancer Society website recommends the following for detecting breast cancer. Yearly mammograms are recommended starting at age 40 and continuing for as long as a woman is in good health. Clinical breast exam, CBE, is recommended about every 3 years for women in their 20s and 30s and every year for women 40 and over. Women should know how their breasts normally look and feel and report any breast change promptly to their health care provider. Breast self-exam, BSE, is an option for women starting in their 20s. Question 2. The American Cancer Society recommends the following beginning at age 50. Both men and women should follow one of these testing schedules: tests that find polyps and cancer, flexible sigmoidoscopy every 5 years, or colonoscopy every 10 years, or double contrast barium enema every 5 years, or CT colonography, virtual colonoscopy, every 5 years. Tests th. At primarily find cancer yearly fecal occult blood test, GFOBT, or yearly fecal immunochemical test, FIT, every year, or stool DNA test, sDNA, interval uncertain. Question 3. The American Cancer Society recommends the following to screen for cervical cancer. All women should begin cervical cancer screening about 3 years after they begin having vaginal intercourse, but no later than 21 years old. Screening should be done every year with the regular Pap test or every 2 years using the newer, liquid-based Pap test. Beginning at age 30, women who have had 3 normal Pap test results in a row may get screened every 2 to 3 years. Women older than May 30 also get screened every 3 years with either the conventional or liquid-based Pap test, plus the human papillomavirus, HPV, test. Case Study Answers 420 Prioritization, Delegation, and Management of Care for the NCLEX-RN Registered Exam Women 70 years of age or older who have had 3 or more normal Pap tests in a row and no abnormal Pap test results in the last 10 years may choose to stop having Pap tests. Women who have had a total hysterectomy, removal of the uterus and cervix, may also choose to stop having Pap tests, unless the surgery was done as a treatment for cervical cancer or precancer. Women who have had a hysterectomy without removal of the cervix should continue to have Pap tests. Question 4. The American Cancer Society recommends men make an informed decision with their doctor about whether to be tested for prostate cancer. Research has not yet proved the potential benefits of testing outweigh the harms of testing and treatment. The American Cancer Society believes men should not be tested without learning about what is known and not known about the risks and possible benefits of testing and treatment. Starting at age 50, talk to your doctor about the pros and cons of testing so you can decide if testing is the right choice for you. If you are African American or have a father or brother who had prostate cancer before age 65, you should have this talk with your doctor starting at age 45. If you decide to be tested, you should have the PSA blood test with or without a rectal exam. Question 5. There is no standard or routine screening test for testicular cancer. Teach the client to perform self-testicular exams monthly to feel for lumps in the testes. This cancer is often found accidentally by the client. Chapter 14 Case Studies, Care of Clients in Various Settings 421 1. Perform hand hygiene and provide privacy for the client. 2. Explain the procedure to the client and ensure all equipment is within reach. 3. Open sterile catheter set package. 4. Place sterile absorbent pad under the client's buttocks. 5. Don sterile gloves from package on dominant hand. 6. Remove sterile articles from tray and arrange on sterile field. 7. Pour antiseptic solution over cotton balls or open swabs with stick end up. 8. Lubricate end of catheter, replace in sterile sleeve, and place between the client's legs on sterile field. Note, it is controversial to check inflation of balloon. Follow hospital policy. 9. Cleanse the client's urinary meatus, separate the client's labia and keep separated during procedure. 10. Use sterile gloved hand with forceps, cotton balls, or swabs to cleanse meatus, one downward stroke only and discard in non-sterile area or bag, repeat 3 or 4 times. 11. Using sterile gloved hand insert lubricated catheter 2 inches or until urine enters tube. 12. Inject entire contents of prefilled syringe, 10 ml, into side arm of the catheter. 13. Retract the catheter until resistance is felt. Note, if client experiences pain, deflate balloon and insert further and re-inflate. 2-1. Perform hand hygiene, don non-sterile gloves, and provide privacy for the client. 2. Explain procedure to the client and ensure all equipment is within reach. 3. Carefully remove old dressing, noting drainage and appearance of needle insertion site. 4. Inspect site for redness, edema, inflammation, tenderness, and exudate. Notify HCP if any signs of infection. 5. Inspect catheter and hub for intactness and remove non-sterile gloves. 6. Apply sterile gloves. 7. Clean insertion site with material included in the dressing kit, cleanse inside to outside in a circular motion to maintain sterile technique, and cleanse about a 3 cm area. 8. Allow area to dry and cover with transparent dressing. Note the date and time of the dressing change. 9. Secure tubing to client's clothing. 10. Dispose of soiled dressing and equipment in separate trash bag. 3-1. Perform hand hygiene and provide privacy for client. 2. Explain procedure to client and ensure all equipment is within reach. 3. Cuff the top of disposable waterproof bag and place in reach of work area. 4. Don non-sterile gloves and place waterproof pad under client. 5. Remove old dressing, and do not apply water if dressing is adhering to the wound. Inform the client of possible discomfort or pre-medicate 30 minutes prior to procedure if needed. 6. Assess the drainage of dressing and dispose in the waterproof bag and remove non-sterile gloves. 7. Prepare sterile dressing supplies, pour prescribed solution over non-mesh gauze. 8. Don sterile gloves. 9. Assess the wound color, character of drainage, presence of type of sutures, and presence of any drainage. 10. Cleanse wound from least to most contaminated area. 11. Apply fine mesh gauze into wound in a single layer, be sure to crunch gauze. 12. Apply dry sterile 4x4 gauze over wet gauze. 13. Cover with ABD pad and secure firmly to abdomen with tape. 14. Remove sterile gloves and put old dressing and equipment in separate trash bag. 4.1. Perform hand hygiene and provide privacy for client. 2. Explain procedure to the client and ensure all equipment is within reach. 3. Open specimen container and place cap sterile inside service up, do not touch inside of container. 4. Give client antiseptic wipe and instruct the client to hold penis with one hand. Using a circular motion, cleanse area with antiseptic wipe from center outside. 5. Tell the client to urinate into commode, then place sterile container under urine stream and collect 30 to 60 ml of urine in the cup. 6. Remove specimen container before flow of urine stops and before releasing the penis. 7. Replace specimen cap on the cup, and cleanse urine from external surface of container. Case Study Answers. Home Health Case Study Answers 422. Prioritization, Delegation, and Management of Care for the NCLEX-RN Registered Exam. 8. Discard gloves and wash hands. 9. Label specimen container with the client's name and pertinent data. 5. 1. Perform hand hygiene, provide privacy for the client, and place protection, towels, under the client. 2. Explain the procedure to the client, ensure all equipment is within reach, and determine if the client can make it to the bathroom or obtain a bedpan. 3. Fill water container with 750 to 1000 ml of lukewarm solution. 4. Prime the tubing with water. 5. Hang the enema bag on 4-pole at bedside 18 inches above the rectum. 6. Don non-sterile gloves. 7. Place client on left side in Sims position. 8. Lubricate tip of tubing with water-soluble lubricant. 9. Gently spread buttocks, instruct the client to take slow breaths, and insert tubing 3 to 4 inches. 10. Open regulating clamp and allow solution to flow slowly. 11. Hold tubing in place and instruct client to take slow, deep breaths. 12. After solution has infused, gently remove tubing. 13. Instruct the client to hold fluid for at least 10 to 15 minutes or as long as possible. 14. Place the client on commode or on bedpan and provide privacy until the client has expelled total volume of enema. 6. 1. Instruct the home health aide to perform hand hygiene and provide privacy for the client. 2. Tell the home health aide to explain the procedure to the client and ensure all equipment is within reach, but the client does not have to wear gloves when performing irrigation. Teach the home health aide the following and perform with the client so aide can better understand the procedure. 3. Position the client on a chair in front of the toilet. 4. Remove used pouch gently and dispose of in separate trash bag. 5. Apply irrigation sleeve over stoma and allow the end to be in the commode water. 6. Fill irrigation bag with 1000 ml of tap water and clear tubing of air. 7. Hang irrigation bag no higher than shoulder height. 8. Lubricate tube tip and hold snugly against stoma opening, do not force cone into stoma, and start inflow of water. 9. Allow water to flow in over 5 to 10 minutes, if cramping starts, stop the flow until cramping stops, encourage the client to take deep breaths. 10. After fluid has entered colostomy, clamp tubing and wait 15 minutes to prevent sudden backflow of water from stoma. 11. Allow 15 minutes for initial evacuation of stool from colostomy, Then dry tip of sleeve and clamp irrigation sleeve and leave in place for 30 minutes to allow more stool to be evacuated. 12. Encourage the client to ambulate while sleeve is on. 13. After 30 minutes, unclamp sleeve, empty fecal content, and remove the sleeve and rinse with liquid cleanser and cool water, hang sleeve to dry. 14. Rinse stoma site with water, note if any rash or irritation around stoma, contact HCP if needed, stoma should be pink and moist. If dark purple or dry, contact HCP. 15. Apply new colostomy pouch over stoma. 7.1. Perform hand hygiene and don non-sterile gloves. 2. Explain procedure to the client and ensure all equipment is within reach. 3. Place arm straight independent position and place towel under arm. 4. Place tourniquet 4 to 6 inches above client's elbow, instruct client to open and close hand. 5. Cleanse antecubital fossa with antimicrobial wipe starting at vein site and cleanse in circular motion and let dry. 6. Hold skin taut and insert needle with bevel up at 30 degrees angle. 7. Lower needle toward skin and thread needle along path of vein. 8. When blood is obtained, pull syringe plunger back gently and then transfer blood to appropriate tube. For vacutainer system, insert blood collection tube into plastic holder while holding plastic adapter steady. 9. Fill syringe to desired amount. 10. Remove needle from vein, cover venipuncture site with a sterile sponge to stop bleeding. 8.1. Perform hand hygiene and don non-sterile gloves. 2. Explain procedure to the client and ensure all equipment is within reach. Chapter 14 Case Studies, Care of Clients in Various Settings 423.3. Elevate the client's head of bed. 4. Ask the client if nose has been fractured or has a deviated septum. Check for nares patency. 5. Place towel on chest and provide emesis basin. 6. Measure N/G tube from tip of the client's nose to earlobe to xiphoid process then mark tube. 7. Coil end of N/G tube over fingers. 8. Lubricate end of tube with water-soluble lubricant. 9. Have client slightly extend head, then insert tube through nostril to back of throat. 10. Ask the client to flex head forward. 11. Have the client sip water while inserting tube until predetermined mark is reached. 12. ASP irate gastric contents to determine correct tube placement. 9.1. Teach the client to pull plunger down to 20 units of air. 2. Insert air into 70/30ths bottle in upright position. 3. Flip bottle to downward position and withdraw 20 units of 70/30ths insulin. 4. Have the client expose abdomen and identify an area 2 inches from umbilicus, belly button, and instruct to rotate sides, right side to left side. 5. Instruct the client to hold syringe like a dart between the thumb and forefinger. 6. Insert needle into skin at a 45 degrees or 90 degrees angle. Client does not have to cleanse skin. 7. Slowly insert 70/30ths insulin, client does not have to aspirate for blood. 8. Remove needle and apply a swab to injection site. 9. Discard needle safely so no one else can use needle, plastic milk carton. 10.1. Instruct significant other to place chair with arms at side of bed. 2. Assist the client to dangle legs on side of bed until stable. 3. Ensure the client has non-slip shoes on. 4. Have the client scoot to side of bed, and instruct significant other how to place gait belt on client, if necessary. 5. Instruct significant other to place his or her foot closest to chair between the client's feet. 6. Rock the client and on the count of 3 assist client to standing position. 7. Grasp gait belt and pivot the client to chair. 8. Instruct the client to place hands on the arms of and slowly lower the client into the chair. 9. Tell the client to scoot back in the chair so the client's back is flush with back of the chair. Case Study Answers 424 Prioritization, Delegation, and Management of Care for the NCLEX-RN Registered Exam 1. 1, D2, I3, L4, F5, A6, M7, O8, B9, H10, N11 times 10 to the power of 12, K13, G14, C2. 1. Initial phase, usually the first 1 or 2 meetings in which the client's anxiety is high. During these meetings, address the reason for the group and group rules, and establish a trusting relationship with the nurse leader along with appropriate interactions with group members. 2. Working phase. These are meetings in which problems are identified, clients begin problem solving, and the group develops a sense of we-ness. These meetings allow the clients to accomplish goals. 3. Termination phase. This is usually the last 1 or 2 meetings. The clients should evaluate the group experience. Some clients may be anxious about ending the group, but others may be glad to disband the group. 3.1. Hallucinations, auditory and visual. 2. Delusions. 3. Disorganized speech. 4. Disorganized behavior. 4.1. Flight of ideas. 2. Continuous activity, and does not respect boundaries. 3. Sexually acting out. 4. Talkative and pressured speech. 5. Easily distracted. 6. Bizarre dress and grooming. 7. Agitated or explosive. 8. Delusions of grandeur. 5.1. Loss of pleasure in life. 2. Change in appetite that may cause weight loss or gain. 3. Inability to sleep. 4. Listless, no energy, or easily fatigued. 5. Feelings of hopelessness or worthlessness. 6. Inability to concentrate or think clearly. 7. May have suicidal tendencies. 6. First, Mr. Aaron must ask Ms. Jones directly if she is thinking of killing herself. Second, if Mrs. Jones says yes, then Mr. Aaron must ask if she has a plan. The more specific the plan, the more serious the threat. Third, see if Mrs. Jones has the method available, such as sleeping pills, a gun. Mr. Aaron should determine if Mrs. Jones has ever attempted suicide before. This is a risk factor for attempting suicide. 7.1. Set limits on intrusive behavior and help the client respect boundaries. 2. Be calm, non-judgmental, and do not get feelings hurt. 3. Encourage the client to walk, throw basketball, and tear rags, any type of physical activity. 4. Discourage the client from playing competitive games such as cards, ping pong. 5. Do not argue or become defensive with the client, interpreting the nurse as being intrusive. 6. Administer anti-mania medication, which will take up to 3 weeks to be effective. 8.1. Do not fight Mr. Chandler's delusion. 2. Use distraction and involve client in reality-based topics. 3. Ask Mr. Chandler what the hallucinations are saying. 4. Mr. Aaron must take action if Mr. Chandler is having command hallucinations, which may cause harm to self or others. 5. Do not pretend to understand what Mr. Chandler is saying. 6. Give short, simple directions. 7. Orient the client by using unit orientation board, as date, month, season, and next holiday. Mental Health Nursing Case Study Answers Chapter 14 Case Studies, Care of Clients in Various Settings 425 9. 1. Assess Mr. Jones for delirium tremens, seizure activity. 2. Administer benzodiazepines, anti-anxiety, medications to prevent seizures, example. Chlordiazepoxide, Librium, diazepam, Valium, clonazepam, Klonopin. 3. Provide high-protein diet. 4. Increase client's oral fluid intake. 5. Monitor intravenous fluids, which may include vitamins, known as banana boat. 6. Keep environmental stimuli to a minimum. 7. Monitor Mr. Jones's vital signs. 10.1. Axis I psychiatric diagnosis. 2. Axis II personality disorder. 3. Axis III medical or physical problems. 4. Axis IV psychological issues affecting the client such as being homeless or jobless, having no family, is divorced. 5. Axis V global assessment functioning, GAF, tool. The higher the number, 1 to 100, the more apt it will be that the client can live independently. Case study answers 426 prioritization, delegation, and management of care for the NCLEX-RN registered exam 1. 1. Moro reflex, startle reflex, is initiated by pulling the infant up from the floor and then releasing the infant. The legs and head extend while the arms jerk up and out with the palms up and thumbs flexed. Shortly afterward the arms are brought together and the hands clench into fists, and the infant cries loudly. The reflex normally disappears by 3 to 4 months of age. 2. Walking, stepping reflex, is elicited when the soles of the feet touch a flat surface. The infant will attempt to walk by placing one foot in front of the other. This reflex disappears at 6 weeks due to an increased ratio of leg weight to strength. 3. Rooting reflex is elicited when the infant's cheek or mouth searches for the object by moving his head in steadily decreasing arcs until the object is found. After becoming used to responding in this way, if breastfed, approximately 3 weeks after birth, the infant will move directly to the object without searching. 4. Sucking reflex is elicited by the roof of the infant's mouth and the infant will suddenly start to suck, simulating the way the infant naturally eats. 5. Tonic neck reflex, known as asymmetric tonic neck reflex or fencing posture, is initiated when the child's head is turned to the side. The arm on that side will straighten and the opposite arm will bend. Sometimes the motion will be very subtle or slight. 6. Palmar grasp reflex is elicited when an object is placed in the infant's hand and strokes the palm. The fingers will close and the infant will grasp it. The grip is strong but unpredictable. Although it may be able to support the infant's weight, he or she may also release the grip suddenly and without warning. 7. Plantar reflex is a normal reflex that involves plantar flexion of the foot in which toes move away from the shin, and curl down. 8. Babinski's sign is initiated when the foot is stroked and there is dorsiflexion of the foot angles toward the shin, big toe curls up. 2. For an APGAR score, a newborn is assessed at 1 minute and 5 minutes and each area can have a score of 0, 1, or 2, with 10 points as the maximum. A total score of 10 means a baby is in the best possible condition. APGAR scores of 3 or less often mean a baby needs immediate attention and care. However, only 1.4% of babies have APGAR scores less than 7 at 5 minutes after birth. Maternal child case study answers sign score equals 0 score equals 1 score equals 2 heart rate absent below 100 per minute above 100 per minute respiratory effort absent weak, irregular, or gasping good, crying muscle tone flaccid some flexion of arms well flexed, or active and legs movements of extremities. Reflex/irritability no response grimace or weak cry good cry color blue all over, body pink, hands and pink all over or pale feet blue Chapter 14 Case studies, care of clients in various settings 427 3. Assess the general health including sleep, feeding, elimination, cry, alertness, respiration, temperature, and apical pulse. A complete newborn screening includes movement, muscle tone, symmetry, and also assesses for jaundice, hydration, and umbilicus. 4. 1. I2 times 10 cubed, A4, B5, D6, H7, G8, C9, G5. Stage 1 latent phase. This is the first phase and is the longest and least intense. Contractions become more frequent, helping the cervix to dilate so the baby can pass through the birth canal. The cervix will dilate approximately 3 or 4 centimeters and efface. Stage 1 active phase. The cervix dilates from 4 to 7 centimeters. The mother may feel intense pain or pressure in the back or abdomen during each contraction. She may feel the urge to push or bear down but must wait until the cervix is completely dilated. Stage 1 transition phase. The cervix fully dilates to 10 centimeters, contractions are very strong, painful, and frequent, coming every 3 to 4 minutes and lasting from 60 to 90 seconds. Stage 1 is complete when the cervix is fully dilated and effaced. Stage 2. This stage begins when the cervix is completely opened. The doctor will instruct the mother to push. The force of contractions will propel the baby through the birth canal. The fontanelles on the baby's head allow it to fit through the narrow canal. The baby's head crowns when the widest part of it reaches the vaginal opening. Pushing helps to deliver the baby's shoulders and body. Stage 3. This is the final stage of labor after the baby has been delivered. The placenta is delivered. 6.1. Hygiene. Shower and wash hair at any time, change pads frequently and cleanse with warm water using peribottle at every change, wipe from front to back, and do not douche or use internal tampons for 4 to 6 weeks. Perineal stitches are absorbable and do not need to be removed. Take a sitz bath 3 times a day and use perineal wipes on your perineum or hemorrhoids. 2. Constipation. Avoid constipation by eating a well-balanced diet including fruits and vegetables and drink plenty of fluids. Stool softeners or mild laxatives may be used. 3. Exercise/rest. Take frequent rest periods, especially when the baby is sleeping. Avoid lifting anything heavier than the baby for 3 to 4 weeks, and do not start vigorous exercises until approved by your provider. Perineal exercises can be started when at home. 4. Call the physician immediately if your temperature is above 100 degrees Fahrenheit, you experience severe cramping or abdominal pains with chills and fever, have heavy bleeding and or pass large blood clots, have foul-smelling vaginal discharge, have increased tenderness, redness, drainage, or separation of stitches, have pain, burning, or difficulty urinating. 5. It is normal to feel tired or overwhelmed or have postpartum blues after going home. This is because of the many physical, hormonal, and emotional changes that occur after delivery. If these feelings continue for more than a few days, notify your provider. Case Study Answers 429-1. The new graduate working on a medical unit night shift is concerned that the charge nurse is drinking alcohol on duty. On more than one occasion, the new graduate has smelled alcohol when the charge nurse returns from a break. Which action should the new graduate nurse implement first? 1. Confront the charge nurse with the suspicions. 2. Talk with the night supervisor about the concerns. 3. Ignore the situation unless the nurse cannot do her job. 4. Ask to speak to the nurse educator about the problem. 2. The charge nurse observes 2 unlicensed assistive personnel, UAPs, arguing in the hallway. Which action should the nurse implement first in this situation? 1. Tell the manager to check on the UAPs. 2. Instruct the UAPs to stop arguing in the hallway. 3. Have the UAPs go to a private room to talk. 4. Mediate the dispute between the UAPs. 3. The graduate nurse is working with an unlicensed assistive personnel, UAP, who has been an employee of the hospital for 12 years. However, tasks delegated to the UAP by the graduate nurse are frequently not completed. Which action should the graduate nurse take first? 1. Tell the charge nurse the UAP will not do tasks as delegated by the nurse. 2. Write up a counseling record with objective data and give it to the manager. 3. Complete the delegated tasks and do nothing about the insubordination. 4. Address the UAP to discuss why the tasks are not being done as requested. 4. The primary nurse informs the shift manager one of the unlicensed assistive personnel, UAPs, is falsifying vital signs. Which action should the shift manager implement first? 1. Notify the unit manager of the potential situation of falsifying vital signs. 2. Take the assigned client's vital signs and compare with the UAP's results. 3. Talk to the UAP about the primary nurse's allegation. 4. Complete a counseling record and place in the UAP's file. 5. The nurse hung the wrong intravenous antibiotic for the postoperative client. Which intervention should the nurse implement first? 1. Assess the client for any adverse reactions. 2. Complete the incident or adverse occurrence report. 3. Administer the correct intravenous antibiotic medication. 4. Notify the client's healthcare provider. Questions. Comprehensive Exam 15-6. The nurse, a licensed practical nurse, LPN, and an unlicensed assistive personnel, UAP, are caring for clients in a critical care unit. Which task would be most appropriate for the nurse to assign/delegate? 1. Instruct the UAP to obtain the client's serum glucose level. 2. Request the LPN to change the central line dressing. 3. Ask the LPN to bathe the client and change the bed linens. 4. Tell the UAP to obtain urine output for the 12-hour shift. 7. Which task should the critical care nurse delegate to the unlicensed assistive personnel, UAP? 1. Check the pulse oximeter reading for the client on a ventilator. 2. Take the client's sterile urine specimen to the laboratory. 3. Obtain the vital signs for the client in an Addisonian crisis. 4. Assist the HCP with performing a paracentesis at the bedside. 8. Which situation would prompt the healthcare team to utilize the client's advance directive when needing to make decisions for the client? 1. The client with a head injury who is exhibiting decerebrate posturing. 2. The client with a C6 spinal cord injury, SI, who is on a ventilator. 3. The client in chronic renal disease who is being placed on dialysis. 4. The client diagnosed with terminal cancer who is mentally retarded. 9. The nurse is caring for clients on a skilled nursing unit. Which task should not be delegated to the unlicensed assistive personnel, UAP? 1. Instruct the UAP to apply sequential compression devices to the client on strict bed rest. 2. Ask the UAP to assist the radiology tech to perform a stat-portable chest X-ray. 3. Request the UAP to prepare the client for a wound debridement at the bedside. 4. Tell the UAP to obtain the intakes and outputs, INOS, for all the clients on the unit. 10. The nurse is assigned to a quality improvement committee to decide on a quality improvement project for the unit. Which issue should the nurse discuss at the committee meetings? 1. Systems that make it difficult for the nurses to do their job. 2. How unhappy the nurses are with their current pay scale. 3. Collective bargaining activity at a nearby hospital. 4. The number of medication errors committed by an individual nurse. 11. The clinic manager is discussing osteoporosis with the clinic staff. Which activity is an example of a secondary nursing intervention when discussing osteoporosis? 1. Obtain a bone density evaluation test on a female client older than 50. 2. Perform a spinal screening examination on all female clients. 3. Encourage the client to walk 30 minutes daily on a hard surface. 4. Discuss risk factors for developing osteoporosis. 12. The female home health, HH, aide calls the office and reports pain after feeling a pulling in her back when she was transferring the client from the bed to the wheelchair. Which priority action should the HH nurse tell the HH aide? 1. Explain how to perform isometric exercises. 2. Instruct her to go to the local emergency room. 3. Tell her to complete an occurrence report. 4. Recommend that she apply an ice pack to the back. 13. The female client with osteoarthritis is 6 weeks postoperative for open reduction and internal fixation of the right hip. The home health, HH, aide tells the HH nurse the client will not get in the shower in the morning because she hurts all over. Which action would be most appropriate by the HH nurse? 1. Tell the HH aide to allow the client to stay in bed until the pain goes away. 2. Instruct the HH aide to get the client up to a chair and give her a bath. 3. Explain to the HH aide the client should get up and take a warm shower. 4. Arrange an appointment for the client to visit her healthcare provider. 430. Prioritization, delegation, and management of care for the NCLEX-RN registered exam 14. The home health, HH, nurse is discussing the care of a client with the female HH aide. Which task should the HH nurse delegate to the HH aide? 1. Instruct her to assist the client with a shower. 2. Ask her to prepare the breakfast meal for the client. 3. Request her to take the client to an HCP's appointment. 4. Tell her to show the client how to use a glucometer. 15. The unlicensed assistive personnel, UAP, is preparing to provide post-mortem care to a client with a questionable diagnosis of anthrax. Which instruction is priority for the nurse to provide to the UAP? 1. The UAP is not at risk for contracting an illness. 2. The UAP should wear a mask, gown, and gloves. 3. The UAP may skip performing post-mortem care. 4. Ask whether the UAP is pregnant before she enters the client's room. 16. The client on a medical unit died of a communicable disease. Which information should the nurse provide to the mortuary workers? 1. No information can be released to the mortuary service. 2. The nurse should tell the funeral home the client's diagnosis. 3. Ask the family for permission to talk with the mortician. 4. Refer the funeral home to the HCP for information. 17. The new graduate nurse is assigned to work with an unlicensed assistive personnel, UAP, to provide care for a group of clients. Which action by the nurse is the best method to evaluate whether delegated care is being provided? 1. Check with the clients to see whether they are satisfied. 2. Ask the charge nurse whether the UAP is qualified. 3. Make rounds to see that the clients are being turned. 4. Watch the UAP perform all the delegated tasks. 18. The charge nurse is making assignments on a pediatric unit. Which client should be assigned to the licensed practical nurse, LPN? 1. The 6-year-old client diagnosed with sickle cell crisis. 2. The 8-year-old client diagnosed with biliary atresia. 3. The 10-year-old client diagnosed with anaphylaxis. 4. The 11-year-old client diagnosed with pneumonia. 19. The nurse is caring for the following clients on a medical unit. Which client should the nurse assess first? 1. The client with disseminated intravascular coagulation, DIC, who has blood oozing from the intravenous site. 2. The client with benign prostatic hypertrophy, BPH, who is complaining of terminal dribbling and inability to empty bladder. 3. The client with renal calculi who is complaining of severe flank pain and has hematuria. 4. The client with Addison's disease who has bronze skin pigmentation and hypoglycemia. 20. The charge nurse is making assignments in the day surgery center. Which client should be assigned to the most experienced nurse? 1. The client who had surgery for an inguinal hernia and who is being prepared for discharge. 2. The client who is in the preoperative area and who is scheduled for laparoscopic cholecystectomy. 3. The client who has completed scheduled chemotherapy treatment and who is receiving 2 units of blood. 4. The client who has end-stage renal disease and who has had an arteriovenous fistula created. Chapter 15 Comprehensive Exam 431 Comprehensive Exam 21. The charge nurse of a critical care unit is making assignments for the night shift. Which client should be assigned to the graduate nurse who has just completed an internship? 1. The client diagnosed with a head injury resulting from a motor vehicle accident, MVA, whose Glasgow Coma Scale score is 13. 2. The client diagnosed with inflammatory bowel disease, IBD, who has severe diarrhea and has a serum K+ level of 3.2 milliequivalent/L. 3. The client diagnosed with Addison's disease who is lethargic and has a BP of 80/45, P of 124, and R rate of 28. 4. The client diagnosed with hyperthyroidism who has undergone a thyroidectomy and has a positive Trousseau's sign. 22. The nurse on a medical unit has just received the evening shift report. Which client should the nurse assess first? 1. The client diagnosed with a deep vein thrombosis, DVT, who has a heparin drip infusion and a PTT of 92. 2. The client diagnosed with pneumonia who has an oral temperature of 100.2 degrees Fahrenheit. 3. The client diagnosed with cystitis who complains of burning on urination. 4. The client diagnosed with pancreatitis who complains of pain that is an 8. 23. The 75-year-old client has undergone an open cholecystectomy for cholelithiasis 2 days ago and has a T-tube drain in place. Which intervention should the nurse delegate to the unlicensed assistive personnel, UAP? Select all that apply. 1. Explain the procedure for using the patient-controlled analgesia, PCA, pump. 2. Check the client's abdominal dressing for drainage. 3. Take and record the client's vital signs. 4. Empty the client's indwelling catheter bag at the end of the shift. 5. Assist the client to ambulate in the hallway 3 to 4 times a day. 24. The surgical unit has a low census and is overstaffed. Which staff member should the house supervisor notify first and request to stay home? 1. The nurse who has the most vacation time. 2. The nurse who requested to be off. 3. The nurse who has the least experience on the unit. 4. The nurse who has called in sick the previous 2 days. 25. The nurse and the unlicensed assistive personnel, UAP, are caring for residents in a long-term care facility. Which task should the nurse delegate to the UAP? 1. Apply a sterile dressing to a stage 4 pressure wound. 2. Check the blood glucose level of a resident who is weak and shaky. 3. Document the amount of food the residents ate after a meal. 4. Teach the residents how to play different types of bingo. 26. The director of nurses in a long-term care facility observes the licensed practical nurse, LPN, charge nurse explaining to an unlicensed assistive personnel, UAP, how to calculate the amount of food a resident has eaten from the food tray. Which action should the director of nurses implement? 1. Ask the charge nurse to teach all the other UAPs. 2. Encourage the nurse to continue to work with the UAP. 3. Tell the charge nurse to discuss this in a private area. 4. Give the UAP a better explanation of the procedure. 27. The wound care nurse in a long-term care facility asks the unlicensed assistive personnel, UAP, for assistance. Which task should not be delegated to the UAP? 1. Apply the wound debriding paste to the wound. 2. Keep the resident's heels off the surface of the bed. 3. Turn the resident at least every 2 hours. 4. Encourage the resident to drink a high-protein shake. 432. Prioritization, delegation, and management of care for the NCLEX-RN registered exam 28. The older adult client becomes confused and wanders in the hallways. Which fall precaution intervention should the nurse implement first? 1. Place a posy vest restraint on the client. 2. Move the client to a room near the station. 3. Ask the HCP for an antipsychotic medication. 4. Raise all 4 side rails on the client's bed. 29. The clinic nurse is caring for a client diagnosed with osteoarthritis. The client tells the nurse, "I am having problems getting in and out of my bathtub." Which intervention should the clinic nurse implement first? 1. Determine whether the client has grab bars in the bathroom. 2. Encourage the client to take a shower instead of a bath. 3. Initiate a referral to a physical therapist for the client. 4. Discuss whether the client takes nonsteroidal anti-inflammatory drugs, NSAIDs. 30. The employee health nurse has cared for 6 clients who have similar complaints. The clients have a fever, nausea, vomiting, and diarrhea. Which action should the nurse implement first after assessing the clients? 1. Have another employee drive the clients home. 2. Notify the public health department immediately. 3. Send the clients to the emergency department. 4. Obtain stool specimens from the clients. 31. The clinic nurse is caring for clients in a pediatric clinic. Which client should the nurse assess first? 1. The 4-year-old child who fell and is complaining of left leg pain. 2. The 3-year-old child who is drooling and does not want to swallow. 3. The 8-year-old child who has complained of a headache for 2 days. 4. The 10-year-old child who is thirsty all the time and has lost weight. 32. Which statement is an example of community-oriented, population-focused nursing? 1. The nurse cares for an older adult client who had a kidney transplant and who lives in the community. 2. The nurse develops an educational program for the type 2 diabetics in the community. 3. The nurse refers a client with Cushing's syndrome to the registered dietitian. 4. The nurse provides the client chronic renal disease with pamphlets. 33. The home health agency director of nursing is making assignments for the nurses. Which client should be assigned to the nurse new to nursing? 1. The client diagnosed with AIDS who is dyspneic and confused. 2. The client who does not have the money to get prescriptions filled. 3. The client with full thickness burns on the arm who needs a dressing change. 4. The client complaining of pain who is diagnosed with diabetic neuropathy. 34. The home health nurse along with an aide is caring for a client who is 3 weeks postoperative for open reduction and internal fixation of a right hip fracture. Which task would be appropriate for the nurse to delegate to the aide? 1. Instruct the aide to palpate the right pedal pulse. 2. Ask the aide to change the right hip dressing. 3. Tell the aide to elevate the right leg on 2 pillows. 4. Request the aide to mop the client's bedroom floor. 35. The charge nurse has received laboratory data for clients in the medical department. Which client would require intervention by the charge nurse? 1. The client diagnosed with a myocardial infarction, MI, who has an elevated troponin level. 2. The client receiving the 4 anticoagulant heparin who has a partial thromboplastin time, PTT, of 68 seconds. 3. The client diagnosed with end-stage liver failure who has an elevated ammonia level. 4. The client receiving the anticonvulsant phenytoin, Dilantin, who has levels of 24 mg/dl. Chapter 15 Comprehensive Exam 433 Comprehensive Exam 36. Which client would most benefit from acupuncture, a traditional Chinese medicine considered complementary alternative medicine? 1. The client who is diagnosed with deep vein thrombosis. 2. The client who is diagnosed with Alzheimer's disease. 3. The client diagnosed with reactive airway disease. 4. The client diagnosed with osteoarthritis. 37. The home health nurse notes the 88-year-old female client is unable to cook for herself and mainly eats frozen foods and sandwiches. Which intervention should the nurse implement? 1. Discuss the situation with the client's family. 2. Refer the client to the occupational therapist. 3. Request the aide to cook all the client's meals. 4. Contact the community's Meals on Wheels. 38. Which legal intervention should the nurse implement on the initial visit when admitting a client to the home healthcare agency? 1. Discuss the professional boundary crossing policy with the client. 2. Provide the client with a copy of the NAHC Bill of Rights. 3. Tell the client how many visits the client will have while on service. 4. Explain that the client must be homebound to be eligible for home health care. 39. The unlicensed assistive personnel, UAP, accidentally pulled the client's chest tube out while assisting the client to the bedside commode, BSC. Which intervention should the nurse implement first? 1. Securely tape petroleum gauze over the insertion site. 2. Instruct the UAP how to move a client with a chest tube. 3. Assess the client's respirations and lung sounds. 4. Obtain a chest tube and a chest tube insertion tray. 40. The nurse and licensed practical nurse, LPN, have been assigned to care for clients on a pediatric unit. Which nursing task should be assigned to the LPN? 1. Administer PO medications to a client diagnosed with gastroenteritis. 2. Take the routine vital signs for all the clients on the pediatric unit. 3. Transcribe the HCP's orders into the computer. 4. Assess the urinary output of a client diagnosed with nephrotic syndrome. 41. The hospital will be implementing a new medication administration record, MAR, for documenting medication administration. Which action should the clinical manager take first when implementing the new MAR? 1. Discuss the new MAR with each nurse individually. 2. Schedule meetings on all shifts to discuss the new MAR. 3. Require the nurse to read a handout explaining the new MAR. 4. Ask the nurses to watch a video explaining the new MAR. 42. Which client warrants immediate intervention from the nurse on the medical unit? 1. The client diagnosed with an abdominal aortic aneurysm who has an audible bruit. 2. The client with adult respiratory distress syndrome, ARDS, who has bilateral crackles. 3. The client diagnosed with bacterial meningitis who has nickel rigidity and neck pain. 4. The client with Crohn's disease who has right lower abdominal pain and has diarrhea. 43. Which assessment data warrants immediate intervention by the nurse for the client diagnosed with chronic kidney disease, CKD, who is on peritoneal dialysis? 1. The client's serum creatinine level is 2.4 mg/dl. 2. The client's abdomen is soft to touch and non-tender. 3. The dialysate being removed from the abdomen is cloudy. 4. The dialysate instilled was 1500 ml and removed was 2100 ml. 434 Prioritization, delegation, and management of care for the NCLEX-RN registered exam 44. The nurse is taking a history on a client in a women's clinic when the client tells the nurse, "I have been trying to get pregnant for 3 years." Which question is the nurse's best response? 1. How many attempts have you made to get pregnant? 2. What have you tried to help you get pregnant? 3. Does your insurance cover infertility treatments? 4. Have you considered adoption as an option? 45. The nurse working at the county hospital is admitting a client who is Rh negative to the labor and delivery unit. The client is gravida 2, para 0. Which assessment data is most important for the nurse to assess? 1. Why the client did not have a viable baby with the first pregnancy. 2. If the mother received a regam injection after the last pregnancy. 3. The period of time between the client's pregnancies. 4. When the mother terminated the previous pregnancy. 46. The unconscious 4-year-old child with bruises covering the torso in varying stages of healing is brought to the emergency department by paramedics. The nurse notes small burn marks on the child's genitalia. Which actions should the nurse implement? Select all that apply. 1. Notify Child Protective Services. 2. Ask the parent how the child was injured. 3. Perform a thorough examination for more injuries. 4. Tell the parents that the police have been called. 5. Prepare the child for skull X-rays and a CT scan. 47. The 24-month-old toddler is admitted to the pediatric unit with vomiting and diarrhea. Which interventions should the nurse implement? Rank in order of performance. 1. Teach the parent about weighing diapers to determine output status. 2. Show the parent the call light and explain safety regimens. 3. Assess the toddler's tissue turgor. 4. Place the appropriate size diapers in the room. 5. Take the toddler's vital signs. 48. The nurse has received the shift report. Which client should the nurse assess first? 1. The client diagnosed with a deep vein thrombosis, DVT, who complains of a feeling of doom. 2. The client diagnosed with gallbladder ulcer disease who refuses to eat the food served. 3. The client diagnosed with pancreatitis who wants the nasogastric tube removed. 4. The client diagnosed with osteoarthritis who is complaining of stiff joints. 49. The nurse and the unlicensed assistive personnel, UAP, are caring for clients on a pediatric unit. Which task should the nurse delegate to the UAP? 1. Sit with the 6-year-old client while the parent goes outside to smoke. 2. Stay with the 4-year-old client during scheduled play therapy sessions. 3. Position the 2-year-old client for the postural drainage therapy. 4. Weigh the diaper of the 6-month-old client who is on intake and output, INO. 50. The home health nurse is planning his rounds for the day. Which client should the nurse plan to see first? 1. The 56-year-old client diagnosed with multiple sclerosis who is complaining of a cough. 2. The 78-year-old client diagnosed with congestive heart failure, CHF, who reports losing 3 pounds. 3. The 42-year-old client diagnosed with an L5 spinal cord injury who has developed a stage 4 pressure ulcer. 4. The 80-year-old client diagnosed with a cerebrovascular accident, CVA, who has right-sided paralysis. Chapter 15 Comprehensive Exam 435 Comprehensive Exam 51. The nurse is preparing to perform a sterile dressing change on a client with full-thickness burns on the right leg. Which intervention should the nurse implement first? 1. Premedicate the client with a narcotic analgesic. 2. Prepare the equipment and bandages at the bedside. 3. Remove the old dressing with non-sterile gloves. 4. Place a sterile glove on the dominant hand. 52. The physical therapist has notified the unit secretary that the client will be ambulated in 45 minutes. After receiving notification from the unit secretary, which task should the charge nurse delegate to the unlicensed assistive personnel, UAP? 1. Administer a pain medication 30 minutes before therapy. 2. Give the client a washcloth to wash his or her face before walking. 3. Check to make sure the client has been offered the use of the bathroom. 4. Find a walker that is the correct height for the client to use. 53. The volunteer on a medical unit tells the nurse that one of the clients on the unit is her neighbor and asks about the client's condition. Which information should the nurse discuss with the volunteer? 1. Determine how well she knows the client before talking with the volunteer. 2. Tell the volunteer the client's condition in layperson's terms. 3. Ask the client if it is all right to talk with the volunteer. 4. Explain that client information is on a need-to-know basis only. 54. The medical unit is governed by a system of shared governance. Which statement best describes an advantage of this system? 1. It guarantees that unions will not be able to come into the hospital. 2. It makes the manager responsible for sharing information with the staff. 3. It involves staff nurses in the decision-making process of the unit. 4. It is a system used to represent the nurses in labor disputes. 55. The visitor on a medical unit is shouting and making threats about harming the staff because of perceived poor care his loved one has received. Which statement is the nurse's best initial response? 1. If you don't stop shouting, I will have to call security. 2. I hear that you are frustrated. Can we discuss the issues calmly? 3. Sir, you are disrupting the unit. Calm down or leave the hospital. 4. This type of behavior is uncalled for and will not resolve anything. 56. The experienced nurse has recently taken a position on a medical unit in a community hospital, but after 1 week on the job, he finds that the staffing is not what was discussed during his employment interview. Which approach would be most appropriate for the nurse to take when attempting to resolve the issue? 1. Immediately give a 2-week notice and find a different job. 2. Discuss the situation with the manager who interviewed him. 3. Talk with the other employees about the staffing situation. 4. Tell the charge nurse the staffing is not what was explained to him. 57. The nurse is preparing to administer the client's first intravenous antibiotic. Prioritize the nurse's actions from first, 1, to last, 5. 1. Check the healthcare provider's order in the chart. 2. Determine if the client has any known allergies. 3. Hang the secondary 4 piggyback higher than the primary 4. 4. Set the intravenous pump at the correct rate. 5. Determine if the antibiotic is compatible with the primary 4. 436. Prioritization, delegation, and management of care for the NCLEX-RN registered exam 58. At 0830, the day shift nurse is preparing to administer medications to the client. Which action should the nurse take first? Chapter 15 Comprehensive Exam 437 Comprehensive Exam 1. Check the client's armband against the medication administration record, MAR. 2. Assess the client's foresight for redness and patency. 3. Ask for the client's date of birth. 4. Determine the client's last K_level. 59. A major disaster has been called, and the charge nurse on a medical unit must recommend to the medical discharge officer on rounds which clients to discharge. Which client should not be discharged? 1. The client diagnosed with chronic angina pectoris who has been on new medication for 2 days. 2. The client diagnosed with deep vein thrombosis, DVT, who has had heparin discontinued and has been on warfarin, Coumadin, for 4 days. 3. The client with an infected leg wound who is receiving vancomycin IV/PB every 24 hours for methicillin-resistant Staphylococcus aureus, MRSA, infection. 4. The client diagnosed with COPD who has the following arterial blood gas, ABG, levels, pH, 7.34, PCO2, 55, HCO3, 28, PAO2, 89. 60. The nurse has been named in a lawsuit concerning the care provided. Which action should the nurse take first? 1. Consult with the hospital's attorney. 2. Review the client's chart. 3. Purchase personal liability insurance. 4. Discuss the case with the supervisor. 61. The nurse has accepted the position of clinical manager for a medical surgical unit. Which role is an important aspect of this management position? 1. Evaluate the job performance of the staff. 2. Be the sole decision maker for the unit. 3. Take responsibility for the staff nurse's actions. 4. Attend the medical staff meetings. 62. The charge nurse notices that one of the staff takes frequent breaks, has unpredictable mood swings, and often volunteers to care for clients who require narcotics. Which priority action should the charge nurse implement regarding this employee? 1. Discuss the nurse's actions with the unit manager. 2. Confront the nurse about the behavior. 3. Do not allow the nurse to take breaks alone. 4. Prepare an occurrence report on the employee. Account number, client's name, 123,456 allergies, NKDA height, 62 inches weight, 105 pounds date medication 23012070007012 1500 1501 2300 Lanoxin, digoxin, 0.1. 25 mg 0900 po everyday Lasix, furosemide, 40 mg 0900 1600 po Bidzantac, ranitidine, 150 mg 0300 NN at in 250 ml NS4 continuous 11 ml/HR infusion every 24 hours vancomycin 850 mg IV/PB 1200-1800 every 24 hours signature/initials day nurse RN DN night nurse RN NN 63. A male HCP frequently tells jokes with sexual overtones at the nursing station. Which action should the female charge nurse implement? 1. Tell the HCP that the jokes are inappropriate and offensive. 2. Report the behavior to the medical staff committee. 3. Discuss the problem with the chief nursing officer. 4. Call a code purple and have the nurses surround the HCP. 64. The night shift nurse is caring for clients on the surgical unit. Which client's situation would warrant immediate notification of the surgeon? 1. The client who is 2 days postoperative for bowel resection and who refuses to turn, cough, and deep breathe. 2. The client who is 5 hours postoperative for abdominal hysterectomy who reported feeling a pop and then her pain went away. 3. The client who is 2 hours postoperative for TKR and who has 400 ml in the cell saver collection device. 4. The client who is 1 day postoperative for bilateral thyroidectomy and who has a negative Kvostek sign. 65. Which client should the nurse in the post-anesthesia care unit, PACU, assess first? 1. The client who received general anesthesia who is complaining of a sore throat. 2. The client who had right knee surgery and has a pulse oximeter reading of 90%. 3. The client who received epidural surgery and has a palpable 2+ dorsalis pedal pulse. 4. The client who had abdominal surgery and has green bile draining from the N/G tube. 66. The client with a below-the-knee amputation, BKA, has a large amount of bright red blood on the residual limb dressing and the nurse suspects an arterial bleed. Which intervention should the nurse implement first? 1. Increase the client's intravenous rate. 2. Assess the client's vital signs. 3. Apply a tourniquet above the amputation. 4. Notify the client's healthcare provider. 67. The client who had surgery on the right elbow has no right radial pulse and the fingers are cold. The client complains of tingling, and she cannot move the fingers of the right hand. Which intervention should the nurse implement first? 1. Document the findings in the client's chart. 2. Elevate the client's right hand. 3. Assess the radial pulse with the Doppler. 4. Notify the client's healthcare provider. 68. The HCP writes an order for the client with a fractured right hip to ambulate with a walker 4 times per day. Which action should the nurse implement? 1. Tell the unlicensed assistive personnel, UAP, to ambulate the client with the walker. 2. Request a referral to the physical therapy department. 3. Obtain a walker that is appropriate for the client's height. 4. Notify the social worker of the HCP's order for a walker. 69. Which task would be most appropriate for the nurse to delegate to the unlicensed assistive personnel, UAP, working on a surgical unit? 1. Escort the client to the smoking area outside. 2. Obtain vital signs on a newly admitted client. 3. Administer a feeding to the client with a gastrostomy tube. 4. Check the toes of a client who just had a cast application. 70. The licensed practical nurse, LPN, is working in a surgical rehabilitation unit. Which nursing task would be most appropriate for the LPN to implement? 1. Bathe the client who is incontinent of urine. 2. Document the amount of food the client eats. 3. Conduct the afternoon bingo game in the lobby. 4. Perform routine dressing changes on assigned clients. 438. Prioritization, delegation, and management of care for the NCLEX-RN registered exam. Chapter 15 Comprehensive Exam 439 Comprehensive Exam 71. The unlicensed assistive personnel, UAP, is changing a full sharps container in the client's room. Which action should the nurse implement? 1. Tell the UAP she cannot change the sharps container. 2. Explain the housekeeping department changes the sharps containers. 3. Praise the UAP for taking the initiative to change the sharps container. 4. Report the behavior to the clinical manager on the unit. 72. The unlicensed assistive personnel, UAP, tells the nurse the client who is 5 hours postoperative for an L3/L4 laminectomy is complaining of feeling numbness in both feet. Which intervention should the nurse implement? 1. Ask the UAP to take the client's vital signs. 2. Request the UAP to log roll the client to the right side. 3. Complete the neurovascular assessment on the client's legs. 4. Contact the physical therapist to check the client. 73. The ED nurse is requesting a bed in the intensive care unit, ICU. The ICU charge nurse must request a transfer of one client from the ICU to the surgical unit to make room for the client coming into the ICU from the ED. Which client should the ICU charge nurse request to transfer to the surgical unit? 1. The client diagnosed with flail chest who has just come from the operating room with a right-sided chest tube. 2. The client diagnosed with acute diverticulitis who is 1 day postoperative for creation of a sigmoid colostomy. 3. The client who is 1 day postoperative for total hip replacement, THR, whose incisional dressing is dry and intact. 4. The client who is 2 days postoperative for repair of a fractured femur and who has had a fat embolism. 74. A terrible storm causes the electricity to go out in the hospital and the emergency generator lights come on. Which action should the charge nurse implement? 1. Request all family members to leave the hospital as soon as possible. 2. Instruct the staff to plug critical electrical equipment into the red outlets. 3. Have the unlicensed assistive personnel, UAP, place a portable flashlight on each bedside table. 4. Contact the maintenance department to determine how long the electricity will be out. 75. The HCP is angry and yelling in the nurse's station because the client's laboratory data are not available. Which action should the charge nurse implement first? 1. Contact the laboratory for the client's results. 2. Ask the HCP to step into the nurse's office. 3. Tell the HCP to discuss the issue with the laboratory. 4. Report the HCP's behavior to the Chief Nursing Officer. 76. The staff nurse is concerned about possible increasing infection rates among clients with peripherally inserted central catheters, PICCs. The nurse has noticed several clients with problems in the last few months. Which action would be appropriate for the staff nurse to implement first? 1. Discuss the infections with the Chief Nursing Officer. 2. Contact the infection control nurse to discuss the problem. 3. Assume the employee health nurse is monitoring the situation. 4. Volunteer to be on an ad hoc committee to research the infection rate. 77. The charge nurse on the 30-bed surgical unit has been told to send one staff member to the medical unit. The surgical unit is full, with multiple clients who require custodial care. Which staff member would be most appropriate to send to the medical unit? 1. Send the unlicensed assistive personnel, UAP, who has worked on the surgical unit for 5 years. 2. Send the RN who has worked in the hospital for 8 years in a variety of areas. 3. Send a licensed practical nurse, LPN, who has 3 years of experience, which includes 6 months on the medical unit. 4. Send a new graduate nurse who is orienting to the surgical unit. 78. The nurse educator is discussing fire safety with new employees. List in order of performance the following actions the nurse should teach to ensure the safety of clients and employees in the case of fire on the unit. 1. Extinguish. 2. Rescue. 3. Confine. 4. Alert. 79. The client tells the nurse, "I am having surgery on my right knee." However, the operative permit is for surgery on the left knee. Which action should the nurse implement first? 1. Notify the operating room team. 2. Initiate the timeout procedure. 3. Clarify the correct extremity with the client. 4. Call the surgeon to discuss the discrepancy. 80. The older adult client fell and fractured her left femur. The nurse finds the client crying, and she tells the nurse, "I don't want to go to the nursing home but my son says I have to." Which response would be most appropriate by the nurse? 1. Let me call a meeting of the healthcare team and your son. 2. Has the social worker talked to you about this already? 3. Why are you so upset about going to the nursing home? 4. I can see you are upset. Would you like to talk about it? 81. The client is confused and pulling at the fore and indwelling catheter. Which order from the HCP should the nurse clarify concerning restraining the client? 1. Restrain the client's wrists, as needed. 2. Offer the client fluids every 2 hours. 3. Apply a hand mid to the arm opposite the foreside for 12 hours. 4. Check circulation of the restrained limb every 2 hours. 82. The charge nurse on a 20-bed surgical unit has 1 RN, 2 licensed practical nurses, LPNs, and 2 unlicensed assistive personnel, UAPs, for a 12-hour shift. Which task would be an inappropriate delegation of assignments? 1. The RN will perform the shift assessments. 2. The LPN should administer all IVP medications. 3. The UAP will complete all AM care. 4. The RN will monitor laboratory values. 83. The head nurse is completing the yearly performance evaluation on a nurse. Which data regarding the nurse's performance should be included in the evaluation? 1. The number of times the nurse has been tardy. 2. The attitude of the nurse at the client's bedside. 3. The thank you notes the nurse received from clients. 4. The chart audits of the clients for whom the nurse cared. 84. The nurse is discharging the 72-year-old client who is 5 days postoperative for repair of a fractured hip with comorbid medical conditions. At this time, which referral would be the most appropriate for the nurse to make for this client? 1. To a home health care agency. 2. To a senior citizen center. 3. To a rehabilitation facility. 4. To an outpatient physical therapist. 85. The nurse is caring for clients on a 12-bed intermediate care surgical unit. Which task should the nurse implement first? 1. Reinsert the nasogastric tube for the client who has pulled it out. 2. Complete the preoperative checklist for the clients scheduled for surgery. 3. Instruct the client who is being discharged home about colostomy care. 4. Change the client's surgical dressing that has a 20 cm area of drainage. 440. Prioritization, delegation, and management of care for the NCLEX-RN registered Exam 86. The nurse is preparing to administer medications to clients on a surgical unit. Which medication should the nurse question administering? 1. The antiplatelet clopidogrel, Plavix, to a client scheduled for surgery. 2. The anticoagulant enoxaparin, Lovenox, to a client who had a TKR. 3. The sliding scale insulin Humalog to a client who had a Whipple procedure. 4. The aminoglycoside vancomycin to a client allergic to the antibiotic penicillin. 87. The nurse is caring for clients on a surgical intensive care unit. Which client should the nurse assess first? 1.